Okay. Good evening, everybody. Slightly difficult topic, cardiac tumors. We don't come across it that we are left in a lurch. So I'm trying to make this as simple as possible and hope we can get through it. So, which is the most common pediatric cardiac tumor? And anyone can answer that? I think it's a pretty simple one. Amitosh Singh says rhabdomyoma. Anybody else has any other ideas than rhabdomyoma? Amol also feels it's rhabdomyoma. So how much percentage of pediatric cardiac tumors is secondary to rhabdomyoma? So rhabdomyoma composes of how much percent of total pediatric cardiac tumors? Can anybody tell me that? 45 to 80. Okay. Yeah, that's right. Somewhere around 65 to 70% of the pediatric cardiac tumors is secondary to rhabdomyoma, which is the next most common pediatric cardiac tumor after rhabdomyoma. So second most common pediatric cardiac tumor after rhabdomyoma. That's right, fibroma. And how much percentage of cardiac tumors is fibroma? Approximately, anyone can answer that? Fibroma composes of 70% is rhabdomyoma, followed by fibroma. So how much percentage is fibroma? 25. It's little on the higher side. So the study from Boston, which did a retrospective study of all the pediatric cardiac tumors, they found that fibroma was the second most common. It's somewhere around 14 to 15% of the pediatric cardiac tumors is secondary to fibroma. So all of the following are true for the pediatric cardiac rhabdomyomas, except rhabdomyoma is a hamartoma with large vacuolated cells filled with glycogen. Solitary rhabdomyomas are associated with tuberous sclerosis in 95% of the cases. Arrhythmias are commonly associated with rhabdomyomas. Fetal rhabdomyomas increase proportionately to the fetal size till 30 to 32 weeks, following which they regress in size. So all of the following are true except. So Amitosh feels it is A. Anybody else has any other answer? Balan Ganesh feels it is B. Anybody else? So Bala, why do you think it is B? Why do you think it is B? Akshata also feels it is B. I want to know why. So if this is wrong, what's the right answer? So that's right, Balanganesh, it is right, because if it is multiple rhabdomyomas, they are associated with tuberous sclerosis in 95% of the cases. About solitary rhabdomyomas, how much percentage of solitary rhabdomyomas are associated with tuberous sclerosis? So solitary rhabdomyomas are usually associated, yeah, that's right, Amitosh, it's approximately 20 to 30% are associated with tuberous sclerosis. Multiple rhabdomyomas are associated most commonly with tuberous sclerosis. Okay, and hematomas the statement A is right. Hematomas are they are hematomas with large vacuolated cells filled with glycogen. Okay, and this is a slide which is showing the vacuolated cells, and they are filled with glycogen. They look like empty cells with nucleus at the periphery, and they are filled with glycogen. So following statements about rhabdomyomas are true except in absence of symptoms, cardiac rhabdomyomas are to be managed medically. Indications of surgery are outflow or inflow obstructions or intractable arrhythmias. Everolimus has found to be beneficial in treatment of rhabdomyomas, and rhabdomyomas are well circumscribed and encapsulated masses. So all of the following are true except. Why is it D? Which part of D is wrong? Yeah, all of you feel it is D, but which part of D is wrong? D is the right answer, but what part of D is wrong? Very good. It is, they are well circumscribed, but they are non-capsulated. Very good, Balaganesh. They are well circumscribed, but not capsulated. So which syndrome? This is a pretty simple one. Is associated with fetal rhabdomyomas. That's right. Tuberous sclerosis is associated with fetal rhabdomyomas. So 30% of the patients with tuberous sclerosis have cardiac rhabdomyomas, while 60 to 80% of patients with rhabdomyomas have tuberous sclerosis. And as we know, they have facial angiofibromas or forehead plaques, non-traumatic anguinal or perianguinal fibromas, hypomelanotic macules, chagrin patches, and multiple retinal hematomas. And identified and require some investigations to be identified are cortical tumors, subependymal nodules, subependymal astrocytoma, cardiac rhabdomyomas, and lymphomyoma of the kidney and renal angiomyolipoma. So which is the second most common pediatric cardiac tumor? And we have done this. The answer is fibroma. So which is the syndrome associated with fibroma? Amitos feels it is Gorlin syndrome. Akshata also feels it's Gorlin. So what is Gorlin syndrome? What is Gorlin syndrome? Can anybody tell me what's Gorlin syndrome? Cyst of jaw. So multiple two or more basal cell carcinomas, or one under 30 years or more, 10 or more basal cell nevi, odontogenic keratocysts or polycystic bone cysts, 3 or more palmar or palmopets, and ectopic calcification, laminar or early Parkes calcification, and family history of Gorlin syndrome. And there are multiple minor criteria which will help you to diagnose what Gorlin syndrome is. So all of the following are true about fibromas except this is a benign tumor of the fibroblast composed of hyalinized collagen and elastic tissues. Ventricular tachycardia is most often the presenting symptoms in children with fibromas. Fibromas do not shrink in size, and typical ECG findings in fibroma include inverted T waves in 2, 3, and AVF. So which of the following is true? Except. So Balaganesh feels it's D, and somebody before that felt it is B. Akshata felt it is B, and Amitos and Balaganesh feel it is D. Can each one of tell me what's wrong? So ventricular tachycardia is composed of how much percentage of symptoms in children with fibromas? So how much percentage of children with fibromas? That's right. Amyloidosis is approximately 60 to 67%, and it is one of the most common symptoms of children with fibromas, and it is more often than not the presenting symptom of children with fibromas. So, if the answer, so which is the most common site of fibroma? What is the most common site of fibroma? Anybody? Which is the most common site of fibroma? Septum. That's probably not right. Anybody else? LV apex is what Amito's Singh feels. It's usually the LV free wall, and that is why. What are the typical ECG findings in fibromas? So LV free wall is usually the most common site of fibromas. So what are the typical ECG findings do you expect in fibromas? Bundle branch block, maybe. Anything else? So what in left lateral? Balconies, what in left lateral? So yeah, it is T-wave inversion in the left lateral leads. It is usually one AVL or V2 to V6. So this is the ECG. You can see it is inverted T waves in one and AVL, and also inverted T waves in V5, V4, V5, V6. Okay, V5, V6, V4, V5, V6. So that is a typical finding in typical ECG finding in patients with fibromas. And if you look at this X-ray, what you can see is a hump over there, and that is suggested fibroma, because the most common site for fibroma is the left ventricular free wall. Okay, all of the following are true except cardiac myxomas are the most common cardiac tumors in adults. Myxomas are neoplasms of multipotent mesenchymal cells of endocardial origin. Although benign, myxomas can recur even after complete excision, and constitution uncommon in myxomas. So Balaganesh feels it's D. Anybody else has any other ideas? Amitos also feels D. So yeah, the first statement is right. Cardiac myxomas are the most common cardiac tumors in adults. In pediatrics, it is the third most common, and they are neoplasms of multipotent mesenchymal cells of endocardial origin. How many percentage of myxomas recur after complete excision? How many percentage of myxomas recur after complete excision? So yeah, answer 4 is right, but percentage of myxomas recur? So myxomas do recur even after complete excision. Approximately 5 to 10% of the myxomas recur after complete excision. And what are the constitutional symptoms secondary to in myxomas? What are the constitutional symptoms secondary to? Constitutional symptoms are symptoms are secondary to release of interleukin, and as you said, they are weight loss, fever, and all the other stuff. So what are the triad of symptoms in myxomas? And I think somebody has already given, Amitos has already said that it's cardiac obstruction, emboli, and systemic illness, which is a triad of symptoms in myxomas. The systemic illness is usually secondary to release of interleukins. So Carney syndrome is associated with what? Carney syndrome is associated with rhabdomyomas, myxomas, fibromas, all of the above. So what is Carney syndrome? What is Carney syndrome? Yeah, it's right. Myxoma is the right answer. What is Carney syndrome? What is Carney syndrome? So what is Carney syndrome? Carney syndrome is familial recurrent myxomas, pigmented skin lesions, recurrent mucocutaneous markers, and various endocrine activities such as thyroid and parathyroid. They constitute the Carney syndrome, and as you rightly said, Carney syndrome is associated with myxomas. So which of the following tumors are associated with pericardial? Intrapericardial teratoma. Okay. Anybody else? So both Palaganese and Amitos it is intrapericardial teratoma. Can rhabdomyoma cause effusion or no? So the answer is all of the above. Malignant cardiac tumors definitely can cause pericardial effusion. Intrapericardial teratoma is intrapericardial, so it can. Rhabdomyoma can cause pericardial effusion if it is associated with obstructive disease, especially in the fetus, like and it can also cause hydrops fetalis. Okay, so all of the above are associated with pericardial effusion. So pick the correct statement. Rhabdomyomas are not compressed during cardiac cycle. Fibromas are not compressed during cardiac cycle. Fibromas are compressed during cardiac cycle, and none of the above. Yes, that's right. Fibromas are not compressed during cardiac cycle, and mainly because sometimes they are associated with calcific deposits. So unlike rhabdomyomas, fibromas are not compressed during cardiac cycle, which is true of intrapericardial teratomas. 15% are classified as malignant. They grow rapidly between 20 to 40 weeks of gestation in the fetus, and maternal alpha fetoprotein levels are low, and all of the above. So which of it is true about teratomas? So yes, grow rapidly between 20 to 40 weeks is the right answer. Approximately 25 to 30% of the intrapericardial teratomas are classified as malignant, and maternal alpha fetoprotein levels are actually high in patients with intrapericardial teratomas, which are diagnosed in the fetal life. And they're more often than not missed during the second trimester scan, and they grow rapidly between 20 to 40 weeks, and they are usually found in the third trimester scans, the intrapericardial teratomas. So what is the blood supply for intrapericardial teratomas? Which is the most common site for intrapericardial teratoma? Anybody? Which is the most? So is it directly from the aorta? So usually, if you see intrapericardial teratomas, yeah, that's right, aorta vasovasorum. So if you see, it is connected to the aorta by fibrous tissue, and that fibrous tissue connects, actually has the blood supply, carries the blood supply from the aortic vasovasorum to the intrapericardial teratomas. The most common site of intrapericardial teratomas is usually the base of the aorta and the pulmonary artery. And what is the, how do you treat intrapericardial teratomas? Is it medical management? Is it surgical excision? Or what do you do with intrapericardial teratomas? Yeah, right, Sudipta, because intrapericardial teratomas are sometimes can be malignant. The only treatment is you have to get it out surgically. Okay. So most common differential diagnosis of intrapericardial teratoma is, anybody? Most common differential diagnosis of intrapericardial teratoma is most common site is the intrapericardial bronchogenic cyst. And how do you differentiate them? Intrapericardial teratoma from bronchogenic cyst? That's right, histology. And what on histology will you differentiate? How do you differentiate on histology? So, very good, Amitos. Intrapericardial bronchogenic cyst will have respiratory and GI tissue, whereas teratoma has neuronal elements. Excellent. So this is the last question. Which is the most common tumor to directly invade the heart? So can I add one more question to this? Which is the most common pediatric malignant tumor of the heart? Is it primary or secondary? Amitos feels it's primary. So if you actually see the malignancy in the primary malignancy in the heart is not very common. It accounts to approximately 15 to 17% of the malignancies which invade which are invasive in the heart, and which is the most common primary malignancy. The most common primary malignancy. Very good. The most common primary malignancy is sarcomas. Okay. So now, which is the most common secondary malignancy out of these four? So Sudipta feels it's leiomyoma, and Amitos feels it is Wilms tumor. The answer is Wilms tumor. Okay, Wilms tumor is the most common malignancy to invade the heart. It goes from the IBC and into the right atrium. So thank you very much for attending this e-session with me. A slightly off-bit topic, I agree. I tried to make it as simple as possible. And thank you so much for participating very actively.